Men have a main problem in the Western world with cardiovascular disease, which is a term covering really all things from coronary heart disease, typically presenting with angina and heart attacks, all the way through to high blood pressure, stroke.
One of the most common cardiac conditions that affect men is an abnormal heart rhythm called atrial fibrillation. And this affects about 1% of the population and around 10% of the population over 80, so it gets more common as you get older.
Lifestyle habits are quite important in influencing the development of cardiac disease in men. Principally they include things such as poor diet, sedentary lifestyle, smoking, drinking too much.
Key foods that are problematic for men in terms of heart health are foods that are high in saturated fat or trans fats or salt. Alcohol consumption is often overlooked by men in the UK. They don't think about how many units they're drinking, how many calories it contains.
Smoking is especially important in developing heart disease in men. A quarter of British men, or approximately, smoke, and therefore it's a big problem nationally. It causes the problem by affecting the lining of the arteries to the heart and actually the arteries throughout the body, leading to the deposition of cholesterol plaques or atheroma, so-called hardening of the arteries, increasing the risk of heart attack and stroke.
Stress causes behavioural change. If you notice that's going on for more than a couple of weeks, it's causing you problems, and you can't change it yourself, then it's time to see a therapist to help you achieve the change that you want.
We're often asked what men can do to monitor the likelihood of them developing coronary artery disease at home. Basically, they should be aware of their weight and to ensure that they're not overweight. If they have any undue concern, in particular, for example, if there's a family history of heart disease, they should seek medical attention to determine if they've got any predisposing factors, for example, a high cholesterol or high blood pressure.